Hello, this is Dr. Daniel Farkas, and I'm here today to talk to you about irritable bowel syndrome. Now, in the United States, irritable bowel syndrome cases in the United States are at least 2.6 million per year. So there are typically two types, IBS-C, which can include constipation, and IBS-D, which can include loose bowel diarrhea. But you can also have both. We have alternating constipation and diarrhea that they just refer to classically as IBS. Now, it's a frustrating condition, and the ordinary approach can include PPIs, which are antacids, which unfortunately can actually cause severe bacterial overgrowth and imbalance and create new problems. Random antibiotics that can just totally disturb that very delicate balance of healthy bacteria in the gut. And of course, antispasmodics that are designed to try to keep the bowel from spasm and causing diarrhea. All these drugs and these types of approaches, they have side effects, and oftentimes they just leave doctors and patients both guessing about what can be done, what should be done, and unfortunately this can lead to disappointment for the doctor and for the client too, the patient. So good news, there are a couple reasons why I feel that we succeed overwhelmingly in these types of cases. Number one, we have advanced testing that goes beyond the ordinary medical testing to look deeper into why this is actually happening in the first place instead of just treating the symptoms. But now number two, and this is what everybody likes, we provide precise, natural support that are based on advanced lab test results and analyses. So let's talk here. Now understand, everybody knows, of course, that there are trillions of bacteria that live in the gut, but understand that they are in communication with the brain, with the immune system, with the hormonal system. A lot of people know about the gut-brain connection and how important it is. These bacteria talk to the brain and immune system. They tell them how to behave. These bacteria, they make 90% of the chemicals that controls our behavioral health. They make 90% of our body's supply of things like serotonin that controls whether we can sleep, whether we can focus, and whether or not we're anxious. This balance is crucial. Understand that something happens called SIBO, known as small intestinal bacterial overgrowth, SIBO, and it's present in at least 60% of cases. So as you watch this, I wonder, have you been properly assessed for SIBO? Have you done a SIBO test? Do you know if you have it because it's present in at least 60% of IBS cases? This means there's a severe dysregulation of those healthy beneficial bacteria. And not only can the digestive problems present, but also serious problems with inflammation and serious behavioral health problems, such as anxiety, depression, ADD, ADHD, OCD, sleep problems, and more. Know this, that when the bacteria get out of balance severely, SIBO bacteria, they promote inflammation. Not only can they cause constipation, not only can they cause diarrhea, but they promote inflammation. They trigger the immune system. And here's an example on the left of a healthy intestinal tract. And understand, when you look in the center of the diagram on the left, there are only a few little bacteria representations, with most of the bacteria in the dark, large intestine. Unfortunately, with SIBO, we can get a massive influx of obnoxious bacteria that have set up shop in the small intestine, and you can see how inflamed it gets. This is severely dysfunctional, again, leads to pain, constipation, diarrhea, and behavioral health problems. This is one part of IBS. Now, when you damage the lining and the wall of the gut with obnoxious bacteria that are imbalanced, that are plastered to the inside of the small intestine, something bad happens. The cells that line the gut, they can crack, they can get weak, they can break down, just like you can get holes in a boat. And when that happens, this allows an influx of a lot of bad things into this red area, right into the bloodstream. This is pesticides, plastics, beauty and hygiene products, food colorings, dyes, water pollution, and all the toxins and all the bad things in the environment get into the bloodstream, circulate everywhere, activate the immune system, bother the brain, disturb hormone metabolism. They affect cardiovascular issues, diabetes, and more. This is a terrible side effect of serious bacterial imbalance in the gut. Just know this, if you have what they call leaky gut, that leads to food sensitivities, even to clean, healthy, organic, and expensive foods. Food sensitivities, they are similar to food allergies. They affect us negatively, they cause inflammation, but the good news is food sensitivities can be reduced over time, where food allergies, those are usually quite long-term. But just know, leaky gut means food sensitivities, means inflammation, and this is the terrible part of irritable bowel syndrome. So back to this again, we know that the brain and the gut are supposed to live in harmony and balance, with balanced, healthy bacteria with no foreign invaders in the gut causing disruption, food poisoning, antibiotic use, and just stress and the chemicals around our normal life. They terribly can disrupt this, leading to irritable bowel syndrome. Just know this, your brain wants to be rid of infectious agents. If obnoxious, bad, trouble-causing things get into your GI system, your brain wants to get rid of them, and it will try to do this relentlessly. And this is IBSD, irritable bowel syndrome with diarrhea. It can be 5 times a day, it can be 20 times a day. And again, this is your brain trying to protect you, just trying so hard. Know this, these infectious agents, they contribute to the loose stool, to the pain, the cramping, and the high frequency of trips to the bathroom. And for some people, this just does not work in their life. Some people are teachers, they have jobs, they have duties and responsibilities at work that they cannot go to the bathroom 5 or 12 times a day. Can't happen. Now, this is something crucial you certainly won't hear in ordinary healthcare settings. The addressing of a very special nerve in your body called the vagus nerve, VAGUS, vagus. This nerve connects your brain to your gut. Your gut and brain are supposed to live and function in harmony. Just imagine a couple that are supposed to be together, sharing a life and sharing a relationship. If one of them becomes highly dysfunctional and becomes very ill, it has a terrible effect on the other one. Just imagine the communication quality between the gut and the brain that goes back and forth when the gut is in a terrible state. Remember, bacteria and the gut, they communicate directly with the brain, the immune system, the hormonal system. This nerve must be assessed to make sure that things are functioning properly. And the good news is that you can improve the function of this, and we regularly see vagus nerve dysfunction in cases of IBS. This is something crucial that gets affected, and oftentimes this is a major contributor to IBS. And a lot of this is triggered by stress. Just understand when all these things are out of whack. You have SIBO bacteria, imbalanced bacteria, infectious agents, vagus nerve dysfunction, leaky gut, food sensitivities, all this. It causes massive inflammation in all areas of the body. On the left, we can see you can have actual inflammation of the nervous system itself, then of the circulatory system, and the center, the respiratory system. Farther to the right, yes, true inflammation of the digestive system. And finally, on the far right, we can have total body inflammation that affects the joints and causes unnecessary joint pain, skin problems like eczema and rashes for no reason. This gut-brain connection and irritable bowel syndrome resolution, it's just so crucial. So we talked a lot about bad things. I want to talk about a new approach and something I've developed over the course of my career called the Farkas method. And what this includes is testing. Advanced stool testing you will not likely find in ordinary medical or gastroenterological settings. We use what we feel is the most advanced stool test for bacterial imbalance and for leaky gut markers. We use food tests for food sensitivities so that our clients know with certainty what foods we need to get out of their diet just temporarily while they're recovering. We use quality SIBO testing to know for sure if there's SIBO overgrowth, and very special vagus nerve assessments for nervous system function. And the great news is that all this can be done at home. These tests are routinely shipped to our clients so that they can test at home and they can start to gather the facts and data about what's really going on with them. Now, what do we do about this? Well, once we have results back of everything, and it doesn't take long, it doesn't take a month, you're talking days, possibly a week or so, to get results. What we then start to deploy is something very special, known in our industry as medical foods. Now, it's a little bit of a misnomer, and understand there's no medicine, But these things work, these natural substances, they work so well, they're so powerful, they're referred to as medical foods. These are special all-natural blends that help to heal the wall of the gut, normalize bacteria, decrease inflammation, and more. We also use special anti-inflammatories that are all natural and very powerful that help to resolve chronic inflammation. Stair-stepped probiotics along the way, this is crucial. The right probiotic at the right time can have a great effect on restoring natural balance in the body. The testing results will indicate what someone needs. During our process, we have our clients avoid their food sensitivities. It's usually just temporary. And we always employ crucial vagus nerve stimulation. This can be done simply at home. We teach our clients how to use simple brain-based therapies that only take a couple minutes per day at home. This is something so important that so many practitioners miss or they pay no attention to at all. Though they're aware of it, it's just not in their field to pay attention to this. And there are aggressive ways of doing this safely that can really make a big difference for a lot of people. Vagus nerve stimulation has been found to lower inflammation, improve gut function, and actually make people happier. A percentage of people that do vagus nerve stimulation within a matter of weeks report being happier. Along the way, we always provide lifestyle major do's and major don'ts because stress does play a role. Now, just imagine the transformation of gut function from constipation and or diarrhea, from guessing, from more medications, from frustration on the part of the ordinary doctor and the patient. Just imagine a path forward that would include eliminating these inflammatory invaders that just cause all this trouble. Finally, repopulating the beneficial, healthy bacteria, healing the leaky gut, decreasing the inflammatory response, becoming independent, and most importantly, in my opinion, having a gut-brain connection that's actually working for you. Instead of having the gut and the brain and the immune system being in between them, just going back and forth, just very unhappy with each other. When we can create this type of harmony, we can create actual true health. So I feel that the goal is this. The pieces of the puzzle are to use advanced testing, advanced stool testing, SIBO testing if necessary, food sensitivity testing, vagus nerve assessment, and that the findings that we find, the problems on these tests, these are the pieces of the puzzle that we can put together to bring things into balance and just restore people back to health and just get them out of the nightmare of IBS-C or IBS-D. So I'm Dr. Daniel Farkas. If you have not done so already, I encourage you to learn more. Reach out to us at Back to Health Natural Solutions. Be well.